time for this week's edition of the Bronson Health Chat on the topic of getting your mammogram in a safe environment. It's important not to put off a mammogram or other imaging tests due to concerns about COVID-19. Bronson has created a safe and caring environment for all patients. It is now rescheduling patients for their screening mammograms and also scheduling new patient appointments. Dr. Christina Jacobs is a radiologist and the breast imaging director at Bronson Healthcare and is with us for our chat this morning on WKZO. Dr. Jacobs, good morning.
Good morning, Ken. Thank you for having me on the show.
Well, we appreciate your time this morning. Now, there's been a lot of discussion regarding the age women should start getting mammograms. Where does Bronson stand on this?
Yes, Ken, there's a lot of confusion. We've come a long way in the treatment of breast cancer. Those treatments are most effective when we can find breast cancer early, and our best chance of finding breast cancer early and defeating it is through screening mammography. Current guidelines are confusing because they have different opinions on what age a woman should begin screening and how often to screen. One thing that's important to point out is that all of these guidelines agree that screening mammography saves lives, and that the greatest number of lives are saved when screening is yearly, starting at age 40. All of the guidelines also agree that women should be offered the option to begin screening at age 40. So at Bronson, we believe saving lives outweighs the potential risks, such as anxiety, and so we recommend yearly screening mammograms starting at age 40.
Is Bronson back to normal now, scheduling patients for screening mammograms?
Pretty much, or at least the new normal. When the pandemic started, we continued to perform breast imaging for urgent cases, women that were having problems, but we postponed all screening mammograms for safety reasons. A few weeks ago, when COVID-19 in our community began showing a continued decline, we started rescheduling the mammograms that were postponed, and we reopened locations that had been closed. And now we're back to scheduling new appointments for screening mammograms. So anybody can call and schedule their mammogram if they're due for one.
And if there are concerns, what type of safety precautions are being taken at Bronson's mammogram locations?
Well, Ken, even before the pandemic, infection control was a priority in our department. Staff have always cleaned their hands before and after every patient encounter, and they've always cleaned all the surfaces of the equipment patients come in contact with before and after each patient. Of course, we understand in the current situation, we want everyone to feel safe, and we're taking many additional precautions. All of our staff are wearing the proper protective equipment for their role. All staff wear protective masks. Technologists wear gloves when performing the mammogram. Patients are required to wear protective masks or face coverings for the duration of their appointment. Staff is taking time to do extra cleaning between patients to prevent any potential spread. For example, after each patient, staff clean all surfaces that may have been touched, including door handles, chairs, desktops, countertops, in addition to the mammography equipment. Efforts are being made to decrease the number of people in common areas at the same time so that social distancing is possible, and our appointments are being spaced out to allow enough time for the extra cleaning to occur and to decrease the number of people at the facility at one time. If a woman wants to get a mammogram but is concerned because of her particular health status, may put her at increased risk if she gets COVID-19, I would suggest she call a Bronson Breast Health Nurse Navigator. Our nurses can help provide advice if special accommodations are needed.
Dr. Christina Jacobs with us on our Bronson Health Chat this week. Dr. Jacobs is breast imaging director at Bronson Healthcare. Can you tell us a little bit about 3D mammograms?
Sure. Bronson has 7 mammogram locations throughout Southwest Michigan, and all except one offer 3D mammography, which is also known as tomosynthesis. 3D mammograms allow us to view the breast tissue in thinner slices, giving the radiologist, the doctor who interprets the exam, more detail. Our experience at Bronson has been that we're finding more early cancers with tomosynthesis than with standard mammograms.
Are there other additional screening procedures that Bronson offers?
Mm-hmm. Yes, we offer breast MRI and whole breast ultrasound. Breast MRI is recommended for women who have higher risk for breast cancer, and whole breast ultrasound is recommended as a supplemental test to mammograms for average risk women who have dense tissue.
Well, Dr. Jacobs, how can our listeners find out more about getting a mammogram and other breast health services?
They can find additional information on mammograms, locations, how to make an appointment, and patient stories on our website, bronsonhealth.com/mammogram. If someone has a specific question about their personal situation, they can contact a Bronson Breast Health Nurse Navigator at 269-341-8517.
Dr. Christina Jacobs has been with us on our Bronson Health Chat this week. Dr. Jacobs is a radiologist and the breast imaging director at Bronson Healthcare. And thank you so much for taking time to be with us and sharing this valuable information.
Well, thank you, Ken. Always a pleasure.
All right, thank you. On News Radio 590 and 106.9 FM WKZO.